Hello, everyone, and welcome to VIDA News Live. I am your host, Dom Garrett. My guest a little bit later on in the show is Dr. John Oyston. He is at the Department of Anesthesiology and Pain Medicine at the University of Toronto. He and I will discuss a new editorial that was just published last week by him that is entitled What Anesthesiologists Need to Know About Vapors. We will also discuss his presentation from the Global Forum on Nicotine, as well as a new long-term international study into the health effects of alternative nicotine products, which you, yes, you, may be able to take part in. But first, we need to talk about Australia. Yes, if you have paid attention to Twitter at all in the harm reduction space in the last week, you understand that something crazy is going on down under. Last Friday, announced by the Australian Health Minister, PM John Hunt, I'm sorry, not John Hunt, Greg Hunt, he said that on July 1st, a new federal regulation will ban the importation of alternative nicotine products and nicotine e-liquid refills. They will not be able to enter Australia. If you are familiar with Australia before, there already was a bit of a ban there. You could not produce any of those products in the country. You cannot sell those products in the country. However, this is the final step in a total ban on those products. It will be illegal. And if you want to try to skirt around the law, it's not just a slap on the wrist and send you on your way. It's a pretty hefty fine to the tune of $220,000. Yes, that's a lot. It's a lot of Vegemite, as they might say. The Australian health minister, he did say that it's not a complete ban. You could potentially have these products prescribed to you by your doctor. However, the amount of red tape could stretch from our studio all the way to the Opera House there in Sydney. It's insane. So you would have to, if you wanted to be able to get these products through a doctor, you would have to ask your doctor. You would have to prove that you had tried every other method of quitting. We're talking about gums, we're talking about patches, we're talking about drugs. Basically, if you bash your head into a brick wall a bunch and you still want to try to quit, then maybe your doctor would be able to prescribe that to you. But your doctor first would have to apply for to the TGA, which is the Therapeutic Goods Administration, for approval for something called Special Access Scheme B. So your doctor has to be approved to be able to prescribe this to you. But like I said earlier, there is no place in Australia that actually produces these products. So your doctor, who is taking time out of their schedule, out of their real time helping real patients, they would have to then get an importation permit from an office called the Office of Drug Control, or the ODC. I've spoke with a couple of people over the course of the last 48 hours, doctors that are there in Australia, and they basically said that, this probably isn't going to happen. That second permit, the importation permit from the ODC, that website, it's not even set up yet. We're less than a week away from when this ban is set to go into place, and the proper websites, the proper permitting, it's not even there. I actually had the opportunity yesterday to speak with Fiona Patten. She is a member of Parliament in Victoria. She's a leader of the Reason Party, a party that is based on science and facts there in Victoria. She has fought for many different harm reduction methods over the years, from safe injection sites and needle exchange programs to protection for sex workers and those that are facing the HIV/AIDS epidemic. And I asked her about this new ban, and this is just a little bit of what she had to say.
Australia has seen itself as some sort of leader in tobacco cessation. And we've been very proud of our plain packaging, our taxation systems on tobacco. But what we're failing to recognise is that was in our past. And we actually have not been making any significant moves in reducing the number of smokers in Australia over the last probably 8 to 10 years. So, to ignore the science on nicotine replacement, such as vaping, is doing Australia a disservice, and you know, at the cost of the health of hundreds of thousands of Australians.
We reached out to Greg Hunt's office for comment on what Fiona had to say. We cited scientific evidence. We cited studies that have come out of the United States, the UK, many places around the world. As you can imagine, their response, PM Hunt decided to not be on our program. The statement that they said that's due to associated health risks, such as nicotine poisoning, that they wanted to take this precautionary approach. Those nicotine poisonings that they cited, it was, you know, obviously we don't want to say that any life lost, you know, any life lost is not, you know, a life that we want to see lost. However, those numbers are very small. And a lot of that just has to do with the packaging that some of these products that have been coming in have had, not necessarily these specific devices. We also spoke with Dr. Joe Kostarich. He is the chairman of the Australian Tobacco Harm Reduction Association, as well as a practicing general practitioner, or what in the United States we would call a family doctor. I asked him why the same government, the Australian government that has supported harm reduction efforts in other areas, seemed to be so opposed to these additional technologies in tobacco harm reduction. And this is what he had to say.
My suspicion is that it's just an ideology, that their view is, look, we've told people for 50 years smoking is bad for you. They haven't listened to us. Well, you know, it's their problem.
So right now, because of those ideologies, over 300,000 Australian consumers are facing the grim reality that the only options they have to get these life-saving products, the products that have helped them stop quitting, added years onto their lives, they either need to try to face, to bring things in illegally and face a small fortune of a fine, or potentially turn to a black market, which, as we know in the United States, can be deadly. We are currently working on a much more in-depth coverage of this story. We should have that coming to you soon, so please make sure to follow VIDA.news, and you will be the first to be able to see that. All right, now I would like to move on to the next portion of our show, where I will welcome Dr. John Oyston. As I said, he's at the Department of Anesthesiology and Pain Medicine at the University of Toronto. Dr. John, thank you so much for joining us on the program today. Looks like we have a little bit of technical difficulties there with Dr. John. The editorial that he penned last week is, like I said, entitled What Anesthesiologists Need to Know About Vaping. One of the things that we attempt to do here at VIDA News, as you know, we have varying levels of our different missions. We want to be able to raise up the voices of consumers. We want to speak to politicians like we did with Fiona Patton and others. But one of the main missions is we want to help aid the communication of tobacco harm reduction advocates and the medical community. Because as you can see in Australia, in some places in the world, there are barriers put in between people who want to be able to quit and how they can get access to those products. And quite often, it's not just the policymakers, it is doctors that have a lot of power. You know, they are the ones that we entrust with our health day in and day out. And in the editorial, Dr. John does a wonderful job of breaking down what anesthesiologists need to know about these alternative nicotine products. He discusses exactly, you know, just the nomenclature that you as a potential harm reduction advocate yourself may already know. And this is the information that doctors just do not always have the access to. As we discussed with the story in Australia, quite often they are running from patient to patient to patient. Dr. John took time out of his schedule to speak with us today. But before this and after this, you know, he has other business that he needs to be able to attend to. And, you know, I do not believe that we might get Dr. John back on the program. Oh, looks like we have him right there. Dr. John, there we go. There we go. All right, let's see if we can be able to pull you on screen. I just gave a nice introduction to you there. You can go ahead and check the replay for that to be able to speak to that. But Dr. John, if you could do me a favor and let me know exactly why did you feel it was important to be able to pen this editorial last week?
It occurred to me that we have all sorts of articles in anesthesia about how to deal with asthmatics, diabetics, drug addicts, but there's nothing about how to deal with people who vape. And in Canada now we have about 4.6 million vapors, and many of those will be undergoing anesthetics. And there's literally nothing in the anesthesia literature about whether they do better or worse than other people or better or worse than smokers. So I sort of put some thoughts together, and so I wrote an editorial which begins by explaining what e-cigarettes are, talks a little bit about the history and about Honlick and how they came to be invented, and then talks about how anesthesiologists should take a vaping history and assess a vapor preoperatively, how they should manage them in the operating room, and how they should deal with them postoperatively, particularly taking into account the fact that some people may be habituated to nicotine and will have nicotine withdrawal if they're not prevented from vaping or smoking and not given nicotine replacement therapy.
Yes, and I definitely appreciate you taking the time not only to to speak with us, but to pen that. Now, you obviously have a lot of you have personal experience here working with patients. Are you surprised at all that there was no literature that was actually published speaking about this to anesthesiologists?
Yeah, I think so. Like if you look at Clive Bates's list of the new publications that come out, there's about 60 publications on vaping every week.
Yes.
And they cover virtually every aspect of vaping that you could manage or you could think of. But it is kind of curious that nobody has actually done a study looking at what happens when you give an anesthetic to somebody who vapes.
Interesting.
Now, I don't expect it to be a problem, but it would be good to know that it isn't a problem.
Exactly. Yes. There's a lot of misinformation out there. If anesthesiologists just see any other coverage of those that use these alternative nicotine products, they tend to be demonized in the media quite often. Have you noticed how? I want to ask you specifically, being a Canadian. We have talked about. We had a story of somebody that used these products that was denied services in Nova Scotia, Ray Yates. We discussed him on the program.
Oh yes.
How do you see the medical community in general in Canada? How do you think that they view these products, or those that use them?
They take a very negative view. They've totally bought into the whole EVALI thing, the whole issue with the so-called vaping epidemic amongst teenagers. Yes. And although at Health Canada level, there was reasonable support, like the Health Canada website says that vaping may be a way that you can help yourself get off cigarettes. And it also says that vaping is less harmful than cigarette smoking. So at that level, it's been good. But at other levels, it's been appalling. For example, the president of the Ontario Medical Association sent out an announcement that began with the sentence, "We all know vaping is dangerous." It's tough.
Yes, it certainly is. So for you personally, obviously you have, you spoke at the Global Forum on Nicotine. You're writing these. What is, if there is a lot of negative coverage of this, how did you find yourself on this side? How did you find yourself being an advocate for the life-saving ability of these products?
I've been concerned about smoking for a long time. Probably about 2006, I first thought about it seriously, and that's when I started a campaign called Stop Smoking for Safer Surgery. Because it's one thing to know as a physician that cigarette smoking causes 12 types of cancer, especially lung cancer, and 20 different diseases. But it's another thing when you actually meet these patients. You meet them with their spouses preoperatively. You talk about their concerns. You're in the operating room when a surgeon removes a lung or a leg or something major like that. And you see them afterwards as you try and help them with their pain after the surgery. And if this was something that was inevitable, that we couldn't do anything about, then so be it. But it's not. We know exactly why. It's because they smoke cigarettes, they're not able to quit, and they're addicted to nicotine. So I'm not basically for vaping, I'm against smoking.
Yes.
But having gone through various other things, like for example, I tried to raise the age for smoking in Canada to 21. At the moment, it seems to me that nicotine replacement therapy with electronic cigarettes is the most promising treatment we have, and it's been working very well in the countries that have allowed it to work. And it seems to be vastly underutilized in Canada and in the States. And it's really something I think that we should be pushing for, and we shouldn't be allowing all this negativity and misinformation to discourage people from vaping.
Exactly. I could not agree with you more. And I think that does, dovetail well into, my next question. You spoke at the Global Forum on Nicotine this year. It was a wonderful presentation. It was, everybody was online. I love the wonderful backdrop that you had of yours, very serene. It's much better than, just a blank wall. But in that, you did talk about potentially some of the conflicts of interest. We hear about, where tobacco funding might be into some of, discrediting some studies. But you actually mentioned that on the other side, there are medical associations that seem to be taking funding from some of these other entities. Do you think that may be some of the reason why we have so much negative coverage on these products?
I think it's quite possible. If you look at things like the American Lung Association, the Campaign for Tobacco-Free Kids, the American Medical Association, these groups, a lot of them are being funded by Johnson & Johnson, which is a big pharmaceutical company, which has a huge charitable foundation. And obviously they're suffering because if people are choosing, as people certainly in England have done, to use e-cigarettes as a way to quit instead of using medications, then Big Pharma is losing out. So, when they're giving hundreds of millions of dollars to organizations like the American Lung Association, you have to wonder what they're getting in return for that.
Yes, it's a question that was brought up in Australia, when you think about all of the money that you actually make on taxing combustible cigarettes as well. One of the
conflict of interest.
Yes, go ahead.
Another conflict of interest that has just more recently occurred to me is when you consider the World Health Organization, and we've probably already talked about Michael Bloomberg and his influence because he donates so much to the World Health Organization for tobacco control. But the second biggest donator to the WHO after America, if America's still giving money, is China. China gets 8% of its government revenue from tobacco. So China itself has a huge conflict of interest if it's involved in WHO tobacco control.
Yes, there's that phrase "follow the money." A lot of times it's used as a weapon against advocates and hung over their heads. But there's a lot that we have to pay attention to both ways. But one, outside of just the money, I want to be able to talk about specific studies, because one of the things that we constantly hear from those that are opposed to these alternative nicotine products is that phrase, "We just don't know. We just don't know the health effects of this. There just is not enough information." And that leads me to this long-term international study that you were mentioning to me. For our viewers, can you give us a little bit of information about what this study is, and potentially how they can take part, and what this could potentially do down the road?
Sure. So it's called the VIDA study, and it's led by Riccardo Pelosa, who's a professor and respiratory medicine specialist in Italy. And he's written a lot of stuff about vaping. He produced 2 small studies, one of which proved that smokers who switch to vaping, their asthma gets better, and another similar study saying that when smokers switch to vaping, their COPD gets better. He also did a small study, a 3.5-year study, showing that there was basically no respiratory effects from vaping. But that isn't long enough and it's not large enough. So he's now got funding to do a 6-year international study. So he has plans to do 20 different places, including 1 in Canada, 3 in the United States, but also Costa Rica, New Zealand, Lisbon, Estonia, a whole pile of places around the world, so that we can get together a proper group. And particularly he wants to look at vapers who haven't got a smoking history, because he wants to separate any harms from vaping from cigarettes use in the past. So he's looking to recruit people who've not smoked more than 1,000 cigarettes in their lives, and who are prepared to be followed with questionnaires and with some testing over a period of 6 years to see what happens to them.
Wonderful. And so for this, we will make sure to link inside of the wrap up of this. But
sure.
So for people that do that, do they just simply need to go to the Veritas website and sort of follow along the prompts there?
They can do that. At the moment, it's there to take their names and email addresses and contact information. Because of COVID, everything has got delayed, and so they aren't yet set up to actually start enrolling people online. But if they either go to that website, or if they want to get more information, they can go to my blog, which I think you're going to give the link to, oyston.com/blog/veritas, and that will give them the link. If they're in Canada, then they should get in touch with me, and I'll give my email address. If not, if they contact, however they get in touch, we'll eventually get them linked up with a local contact in their own country or their own city.
Wonderful. Well, Dr. John, I appreciate you taking the time and working through. It just shows me how much you actually do care about this. You really do care about patients and want people to get this information, to work through and call on your phone. I appreciate you taking the time, and I look forward to being able to speak to you again soon.
Sure. Okay. Thanks so much. Sure.
Thank you so much. All right. That was Dr. John Oyston at the Department of Anesthesiology and Pain Medicine at the University of Toronto. As I was saying, as he was jumping in, one of the main things that we focus on here at VIDA News is making sure that we can improve the global communication between users, between scientific evidence, and those doctors that are on the front line treating those patients. That is what we are about here. It's harm reduction. It's reducing the harm, less cigarettes, more birthdays. That is all that we have for our program today. Like I said, please follow us at vida.news on all of your social platforms. You can find us on Facebook, Instagram, LinkedIn, Twitter. And we will be talking more about the story in Australia. Again, there is just about a week left, so please make sure to pay attention to that. We will have all of the details wrapped up on our website at vida.news, where you can see all of our past broadcasts, the conversations that we have had, sign up for our weekly email newsletter, and more. Thank you so much, and I look forward to seeing you again next week.